So I'm delighted to share my time with Senator O'Loughlin. She has a long track record of advocating for a publicly funded IVF system in the Dáil. The statistics, as we know, show that infertility affects 1 in 6 couples, and it affects both men and women equally. Having lived through the highs and lows of 5 IVF cycles, the worry, the waiting, the failures, the pain, I strongly believe that the state simply does not do enough to support couples facing this challenge. I was one of the lucky ones. I was able to afford cycles, and eventually we hit the jackpot. There are so many people out there, Catherine Ardagh and Minister, who simply cannot. And there are so many who can't even afford 1 cycle, let alone several. And there are so many who spend every single penny they have on IVF, and sometimes it ends unsuccessfully. The cost of IVF in Ireland can start at €4,500, but realistically, with blood tests and consultations, can end up near €10,000. In 2019, Minister Harris set out a very ambitious roadmap for IVF services in this country. The first step was going to your GP. The second step was going to a newly established regional IVF fertility hub, and the third step was the provision of IVF. The problem with this scheme was that he only allocated €2 million to it, and clearly €2 million does not go far enough. So what we're looking for today is a properly funded public health IVF scheme. The Assisted Human Reproduction Bill goes some way in providing safeguards to patients in the form of regulation. Fertility clinics in Ireland are regulated by the Health Products Regulatory Authority, but there is still nobody that oversees the fertility industry generally, and there is massive need of improvement in this bill due to the changes in genetics and modern medicine. I'm going to cut it out a lot. And people, obviously, who are desperate to have a child are the most vulnerable and hugely open to exploitation. They are facing mental, physical and relationship channels, and on top of it all, huge financial barriers. Okay. I'm going to let my colleague. Okay.
Thank you, Chair, and thanks to my colleague Senator Ardagh for introducing this, and we are intending to work together on a bill to address the failings that are presently there. Can I wish everybody a very happy St Bridget's Day, and I think it's very fitting that today is her day because she was the saint for infertility and helped women in her time who could not conceive, and that is almost 1500 years ago. The World Health Organization is very clear that infertility is a disease and should be treated as such with absolute support. In Ireland, those that cannot conceive naturally, and we all know those who have gone through the grief and the heartbreak of trying to start their own family and not being able to, they get very little or no support within the public health system. Those in need of IVF and other fertility programmes find themselves paying between £6,000 and £10,000 a cycle. At the moment, fertility drugs are only covered by the Drugs Payment Scheme or a medical card, and private patients can claim tax relief, but that is it, and that is just on fertility drugs. The state absolutely need to help with not just with costs, but also medically, so that there is a continuity of care. As my colleague said, in 2017, the then government approved a bill which laid out regulation and need for establishment of a regulatory body, and then in 2019 gave more details of a model of care, but nothing has happened since. I acknowledge, Minister, that you confirmed additional funding and supports and opening of fertility hubs in Budget 2021. We need a functional and fair state-sponsored system of supporting infertility, and we need to be able to determine criteria and eligibility. I certainly hope that you can achieve what your predecessor did not. Thank you, Minister.
Can I thank Senators Catherine Ardagh and Fiona O'Loughlin for raising this and giving us the opportunity to discuss it this morning, and start by saying that I agree entirely with what both senators have said. We have an ambitious plan to progress this. It is moving. It's a very important programme for government commitment, and it is critical that couples who are seeking help in terms of fertility, including IVF, that they are supported, and we want to see them supported in the public health system. We want to move away from a situation where, for many people, because of the huge costs, that it's not something that it is affordable. We want everybody to have the same chances, regardless of income, and that really is the goal here. As the senators will know, the programme for government commitment introduces the model for care developed by my department and the HSC, and the model ensures that infertility issues will be addressed through the public system at the lowest level of clinical intervention necessary, which is an important principle. And as Senator Ardagh has said, the model comprises 3 stages, starting with primary care with the GP, extending into secondary care through the setting up of these regional fertility hubs, and then, where necessary, tertiary care, IVF and other advanced human reproduction as well, or assisted human reproduction treatments as well. Structured referral pathways will be put in place and patients referred onwards for further investigation or treatment as required and, of course, as clinically appropriate. The rollout of the model, I'm glad to say, has commenced and involved the establishment at the secondary care level of the regional fertility hubs in maternity networks. So the hubs will facilitate the management really of a significant proportion of patients presenting with infertility issues without the need to undergo invasive IVF or other advanced AHR treatments. They will accept direct referrals from GPs and will provide patients with more direct, faster access to teams specialising in fertility, which obviously is really, really important. The focus last year was on commencing the development of the first 4 of these regional fertility hubs. And additional, as Senator O'Loughlin has said, we have additional funding now this year to set up the final 2 hubs to continue with this rollout. The final phase then of the model of care rollout will see the introduction, and I think this goes to a lot of what both senators are saying today, of the tertiary infertility services, including IVF, critically in the public health system, which is just so important. This phase will commence when the infertility services at second level have been developed across the country, which is what we're working hard on. A clearer picture of the specific level of demand for tertiary treatment, obviously, and the required resources allocated, as has been raised by both senators. The AHR legislation is commenced and the regulatory authority for AHR is operational. So they're the steps we put in place. So there are a lot of steps to do this, but we've got to really push it and push it very hard. Drafting the legislation is ongoing by officials in my department, and they're working closely with the Office of the Attorney-General. And the publication of the AHR bill is a priority for this government, and its enactment is included in the programme for government. It's really important that we do this. It should be noted that while AHR treatment is not currently funded by the Irish Public Health Service, there is support available, as Senator O'Loughlin has said, for patients who access such treatment privately, for instance, tax release on the costs. But that can't be the model. The model has to be access through the public system, and affordability cannot be one of the factors. Given the costs associated with certain fertility medicines, there can be a material impact on the total cost of AHR treatment for those individuals who are eligible for and avail of the medical card or the drug treatment scheme through their use of medicines covered under the high-tech scheme, which is administered by the HSC. Overall, the implementation of the model of care will help to ensure the provision of safe, effective and accessible fertility services at all levels of the public health system as part of a full range of services in obstetrics and gynecology. Thank you.
30 seconds.
Just very quickly, obviously the provision of the 3rd stage of free IVF is what we're really looking for. That's the cost prohibitive measure for couples. But in relation to the AHR bill, you have to accept, Minister, when you were bringing it forward, that many couples in Ireland travel to other jurisdictions to escape the restrictions in their own countries in relation to egg donation and surrogacy. And I'd really like a debate within the House and generally in relation to how we can deliver these practices in this jurisdiction. I hope my friend has another time as well to come in.
Thank you, Senator. And Minister, I'm really pleased, as I've no doubt many are, that this is a priority for government. And I think what you're saying is absolutely 100%. This is about equality and equity of access to that support that is needed to start their own family. Money should not dictate, as it does now, whether people have access to this or not. We all know many that have remortgaged homes or indeed put off buying their own homes because they need to pay such high costs in relation to this. You rightly say that the availability should be safe, accessible and effective. And just one question to you, Minister, and I appreciate that you've given us the chronological order, but I would like to know if you have a timeline in relation to that 3rd phase, in relation to the state helping support IVF, such as they do in Scotland, for example, with 3 cycles paid for by the state once you have the relevant criteria, etc. Thank you.
Thanks, Chair. Can I conclude by thanking again Senators Ardagh and O'Loughlin for raising the issue and allowing us to debate it today. I should state that the drafting of the AHR bill and the rollout of the model of care, which really are a priority for government, priority for me, obviously a priority for the senators who have advocated long and very well on this issue, and I'd like to thank them for that. The drafting and the rollout have been subject to delays with regard to COVID. Obviously, dealing with COVID has pulled in the HSE in every which way, pulled in the department in every which way. So it has impacted on the normal work streams, and indeed this would be one of them. However, I just want to reiterate to the House and to my colleagues that I am committed, and the government is committed to the rollout of this model of care for infertility in line with the available resources. Ultimately, the end goal is to achieve full implementation of the model of care. That's really what matters and what we've got to focus on. What does that mean? It means patients always receiving care at the appropriate level of clinical intervention, and then those who require and are eligible for advanced treatment being able to get that through the public health system, which I just think is so important. I hope this is of assistance today. Thank you.
Perfect. Thanks, Minister.